The work that I do looks at food marketing, and I work around understanding food marketing in relation both to very young children, so kids before they've even started school or in their first year of primary school, and also with older kids, kids in their early teens, who are more likely to be using social media, and understanding how food marketers try to reach them, the extent to which they are reached by this kind of food marketing, and how that shapes their understandings and their practices around food in relation to what they know about and, in social media, what they might want to share and so on and so forth. And the underlying premise of it all is trying to understand this one part of this really intractable problem that we have with a large-scale overweight and obesity problem in this part of the world, but across the world now. We call it the two faces of malnutrition, where we have people who aren't getting enough good nutrients, but also maybe getting too many calories, and therefore their health is impacted as a result. Almost all the foods that are marketed through all these various means are foods that are high in energy density but low in good nutrients, so they're ultra-processed foods. And unfortunately, they're just not healthy to eat unless they're very occasional treats. And yet, if you look at what we call children's advertised diet or their marketed diet, so the overall picture of foods that they are shown over and over again in all these different media and shops and other outdoor settings, it's almost exclusively things that you should only eat as a treat. So it really poses a problem. How do you then, as a person living in a society like that, enact these healthy choices that public health is always saying it should be up to you, you need to make the choice, and you're not even really in a position to make healthy choices when what you're being fed visually all the time is the unhealthy stuff. We're really interested in the very youngest of children because it is in the early years, before you even start school, that your taste development and your eating patterns are set. Now, it's not to say that you can't change anything later, but pretty much in those preschool years is your last opportunity to set good habits and flavour practices, as it were. And so understanding the responses to food marketing among the very youngest children is really important. And what our research has shown is that, even by the time they're 3 years old, they're recognising to a large extent, food logos of companies that sell largely unhealthy foods, and recognising those unhealthier ones at a greater rate than they're recognising the healthier ones. And so this tells us that the food marketing is having an effect on children already by the time they're 3, by the time they're 5. They're recognising almost all of the unhealthy logos that you show them. And so it's almost as if the deck is stacked against children and families, and they don't even really have that much of an opportunity to sort of enact their free choices in that context. So a lot of the work that I've done has been on the island of Ireland, so in the Republic of Ireland and Northern Ireland. In terms of, so Safe Food is an all-island food safety authority, and they support a lot of research and action in seeking to have healthier diets across the island of Ireland. And so that study with the preschoolers was supported by them. And since then, the Irish Heart Foundation has funded work that I've done looking at food marketing in social media. And that has led on directly to impacts in relation to working with the World Health Organization, the European Commission, and also recently to an amendment to the Data Protection Bill in the Parliament, in the Houses of the Oireachtas in Ireland. And so that bill was just passed in May 2018. And that says that you mustn't profile or track or target children in digital media for commercial gain. So it's going to be very interesting to see how that's going to play out in the policy environment now across Europe. There seems to be a real groundswell of interest across Europe and probably globally, I think, in addressing this issue. I suspect largely because we've got such a grave public health problem coming down the line. Well, in fact, I wouldn't say it's coming down the line. I'd say it's here and now. And there's, at last, a widespread recognition that it needs to be dealt with.